several cases of cancer that we have in this country, people struggling to gain access to affordable healthcare, which is very elusive. But what lessons do we learn? Having worked with this gentleman and what he has gone through, what lessons do we learn in terms of taking care of patients suffering from this kind of situation?
Look, when you talk about Bob Collymore, he got the best of care. The best of the best of care. He was in a room, in a bubble in the UK for like 7 weeks. Nobody could visit him. He was in this room, and they sealed it off because it was bone marrow. The cancer was inside the bone marrow. So obviously very expensive. It was a new type of treatment he was getting called stem cell. So it was, largely untested. But they were very confident when they were done with the surgery, and he came out. I mean, he was looking pretty good. He gained some weight. He was back to to good form, and then his blood started rejecting it. In fact, a few weeks ago, he had asked Wamboi, his wife, had asked a couple of us to donate our blood for platelets. In the blood, you have different kinds of things in your blood, but one of them is your white blood cells, red blood cells, and platelets, right? Platelets are the ones that help your blood to clot.
Sure.
So his blood was refusing to clot. So he would get a nosebleed out of the blue. If he pricked himself, the blood, it will take a while to clot. Yeah. So he needed the platelets to help his blood clot. And a couple of us donated our platelets for that. So when it comes to healthcare, I mean, first of all, you just thank God if you're in good health.
That's true.
When people come to you and say, I'm looking for a work, I haven't worked in a year because I can't find a job, but they've got 2 legs, 2 feet, and they're in perfect health, I just don't get it. That makes no sense.